The word pandemic, it's been almost constantly in our conversations lately. It can feel incredibly overwhelming, right? Trying to keep up with what these global health crises truly mean, how we navigate them, and crucially, what lessons we should be taking away. But what if we told you there's maybe a shortcut? A way to get a handle on the entire landscape of pandemic preparedness, from like the echoes of ancient plagues all the way to the most cutting-edge modern strategies.
That's precisely our aim today. We're launching into a deep dive. We're meticulously sifting through a really fascinating collection of sources, articles, research papers, strategic policy documents to extract the essential insights. We want to understand how pandemics truly spread, examine our past responses, and critically uncover how we can be far, far better prepared for the next disease X.
Yeah, our mission is pretty simple, really. We want to help you quickly become genuinely well-informed, give you those aha moments with some surprising facts, clear explanations, and enough context to make sense of what often feels like just an overload of information. We're going to unpack the entire journey, from early detection right through to global strategies, pinpointing not just the systemic challenges, but also the breakthroughs that are shaping our future health security. So let's dig into this and connect some truly important dots for you.
Okay, so we hear terms like outbreak and epidemic all the time. But what truly elevates a disease event to a pandemic? And, in our modern world, has humanity really experienced anything on this scale before? It sometimes feels so unprecedented, doesn't it?
Well, our sources make it pretty clear. A pandemic is defined as an epidemic that spreads across more than one continent. And the remarkable insight here is that these global events, they're far from a modern phenomenon. The very concept has been with us for centuries. Actually, the term itself was first used to describe a continuously spreading disease way back in 1666. Wow, 1666. That's a fascinating bit of history. And our sources really give us this whirlwind tour of just how far back these global health crises stretch. And they reveal some surprisingly consistent patterns.
Indeed they do. Consider the Antonine Plague from 165 to 180 AD. Believed to be smallpox, it decimated an estimated 33% of the Roman Empire. We're talking maybe 5 million deaths. What's striking is how its spread was amplified by Rome's extensive political and trade networks. You see the connection. Then there's the Justinian Plague in 541 AD, caused by Yersinia pestis, that's the plaguepterium, transmitted from rats to humans via fleas. It killed an estimated 60% of the Mediterranean world. DNA evidence from burial sites has even confirmed the pathogen. So these historical accounts aren't just grim statistics. They reveal that human connectivity, even back then, has always been a primary accelerator for disease spread, almost regardless of the specific bug.
It's a powerful reminder, isn't it, that our own infrastructure for progress, for trade, for connection can become a superhighway for disease. And even in much more recent history, we've faced significant events that kind of echo these ancient challenges.
Absolutely. The Asian flu of 1957, 1958, that was an H2N2 influenza virus, originated in China, spread globally, claimed over 1 million lives. And more recently, think about the Ebola outbreak that emerged in Guinea back in 2013. It affected 28,000 people, killed 11,000, and tragically, many dedicated healthcare workers were among them. These events, though, diverse in the pathogen and where they happened, they consistently highlight humanity's ongoing struggle with novel diseases, but also our capacity for adaptation and scientific discovery.
Right. And beyond the sheer devastation, what's really compelling, and our sources point this out, is how these past pandemics also spurred scientific breakthroughs. We're talking about the concept of quarantine, which evolved from responses to the Black Death centuries ago, and the development of vaccines, smallpox vaccines, for instance, that laid the groundwork for modern immunology. Yet despite these advances, some public responses like disbelief, the spread of misinformation, inconsistent communication, they seem to repeat across centuries, from the Black Death right up to COVID-19. It's almost like humanity keeps running into the same communication and trust pitfalls. It's quite striking. Okay, moving from those historical patterns, let's fast forward to COVID-19. Our sources highlight a precise, almost alarming chronology of events. It really shows just how quickly a novel virus can circle the globe, and how those early actions, or maybe the lack thereof, fundamentally shaped the crisis that followed.
The COVID-19 pandemic certainly confirmed many previously identified systemic risks, and vulnerabilities really on a global scale. Looking back at those early days in Wuhan, the timeline is quite striking. According to The Lancet, the first cases dated to at least December 1st, 2019. That indicates the virus was circulating weeks before the public really understood its scope. And, importantly, not definitively originating from the Huanan seafood wholesale market, as initially thought, By late December, hospitals in Wuhan were already identifying these cases of pneumonia of, well, unknown origin.
So we're talking about a quiet, almost invisible emergence, even before public alarm bells started ringing widely. That must have created a huge blind spot, right?
Exactly. A huge blind spot.
Yeah.
On December 30th, the Wuhan Municipal Health Commission issued urgent notices to hospitals. These then leaked online and were reported. But a crucial point from the sources is this. WHO headquarters first learned of the outbreak on December 31st via ProMed. That's a U.S.-based open-source platform, not directly from Chinese authorities initially. They then requested verification, and China officially notified WHO and began sharing information on January 3rd, 2020. This sequence, you see, it underscores the immediate challenge of information flow in a rapidly developing crisis.
So the global health community was, in a way, getting its first signals from outside the official channels. And how quickly did this localized event become a global concern?
Oh, rapidly. Just incredibly fast. By January 13th, Thai authorities confirmed the first case outside China. This was an individual who had traveled from Wuhan. Then, on January 23rd, Wuhan suspended public transportation. But by that point, millions of people had already traveled to and from the city since early December. Researchers estimate a staggering 86% of infections among those travelers went undocumented. That reveals a massive silent spread already well underway.
86% undocumented infections. That figure is truly astounding. It really drives home how a localized event became a global crisis before many even knew what was happening, due to both the virus's inherent nature and, significantly, those initial information flows. It's a powerful illustration of the domino effect in action, isn't it? Where early undetected spread just became the foundation for everything that followed. Hard to grasp, really. So, considering that rapid global spread, let's turn our attention now to how some nations navigated the storm. Our sources identify some significant national vulnerabilities, using the U.S. response to COVID-19 as a compelling case study that reveals weaknesses which, unfortunately, seem to compound the crisis.
The U.S. experience with COVID-19 certainly exposed several critical vulnerabilities. Spanning everything from testing infrastructure to communication strategies and internal coordination. Take testing failures, for instance. The U.S. initially decided to rely exclusively on domestically developed tests. The CDC developed its own test in early February, but a faulty reagent, a problem with one of the components in its kits, meant most labs couldn't even use them effectively.
Right, and this really put the U.S. behind other countries right at the start, didn't it? I remember the stark contrast with South Korea being discussed a lot. What were the fundamental differences, beyond just that faulty test, that allowed them to mobilize so much faster?
That's where the sources offer a really powerful comparative insight. South Korea confirmed its first case on January 20th, the exact same day as the U.S. But, and this is key, they had a pre-existing national strategy. It engaged multiple private companies to produce tests rapidly, so they tested 3 times as many citizens per capita. They managed to keep cases down to around 11,000 in those early months and maintain a mortality rate 2.5 times lower than the U.S. They even conducted over 65,000 tests in just 1 week to stop a localized outbreak traced back to nightclubs.
Wow, 65,000 tests in a week.
Yeah. The U.S., with a population 6 times larger, didn't perform a similar number of tests until nearly a month later. So the deeper insight here isn't just about one faulty test kit. It's about how a brittle system, one already suffering from long-standing underinvestment, created this cascade of problems. That single point of failure could trigger widespread shutdowns and massive economic disruption.
So it wasn't just the sheer number of tests, but the speed, the decentralization, and maybe the foresight built into South Korea's system that made the difference.
Okay. What about how the public was informed during the crisis? How did communication play out?
Communication was another major weak point, according to the sources. U.S. campaigns were described as scattered, inconsistent, and often politicized, rather than strictly science-based. You had officials offering inconsistent opinions and, at times, contradictory public health guidance. Administration officials apparently delayed and limited outreach from CDC experts who really should have been front and center. This created what one CDC director actually termed a bankruptcy of trust.
A bankruptcy of trust. That's a strong phrase.
It is. It's where public confidence in experts diminishes and misinformation can spread even faster than the disease itself. A really dangerous situation.
It sounds like years of underinvestment in public health infrastructure also played a huge foundational role, made the system fragile to begin with. Absolutely. Our sources point that out very clearly. Years of federal underinvestment in state and local public health emergency preparedness. Funding for CDC's public health emergency preparedness cooperative agreements, for example, decreased by over 25% since 2002. That significantly undercut the U.S.'s baseline response capability. On top of that, the U.S. lacked a truly unified response. You had states often diverging in strategies, even competing for essential supplies like masks and ventilators. This paucity of coordination at the federal level led governors to form their own regional coalitions, highlighting a fragmented approach when unified action was most needed.
And when you mention competing for supplies, that brings us squarely to the global supply chain vulnerabilities that became so painfully evident.
Precisely. The shutdowns in China during January and February of 2020 revealed just how concentrated production was and how fragile global supply chains were. This led to critical shortages of essential medicines and personal protective equipment, PPE, not just in the U.S., but also across Europe. And that directly reduced the capacity to respond effectively. Frontline workers didn't have what they needed.
And all of this was compounded by what seems like a significant lack of clear, actionable data, especially early on.
That's a critical point raised in the sources. In the early weeks, there was no single repository, not at the CDC or WHO, for standardized open-source data. U.S. disease surveillance was fragmented across multiple federal agencies. There wasn't a true national system for consolidating reporting from states. This led to inconsistent and delayed data, hindering the ability to detect threats quickly and learn from what other governments were experiencing. The collective insight, really, from all these issues is just how interconnected policy, infrastructure, and public trust truly are in a crisis. When these elements fail, the human and economic toll escalates dramatically. It creates this compounding effect that stretches a system to its breaking point.
Okay, moving beyond national responses, our sources also shed important light on the broader international system. What's truly insightful here is the structure that's actually meant to coordinate global health emergencies and, well, the inherent paradoxes within its design.
Right, you're likely referring to the International Health Regulations, or IHR. This is a binding international agreement, revised back in 2005, signed by 196 states. It outlines rules for identifying and sharing critical information about disease events, and also for maintaining core capacities for prevention, detection, and response. It's designed to be the bedrock, really, of global health security, obligating countries to report events and build capabilities.
So on paper, it sounds like a pretty robust, globally agreed upon system. But the COVID-19 experience seemed to expose some significant cracks, didn't it? Particularly in WHO's ability to truly lead and enforce. What were the core limitations that the sources identified?
That's one of the key takeaways. While the IHR defines WHO's duties, the COVID-19 experience suggests WHO lacks sufficient independent investigative authorities and resources to lead and coordinate coherent international responses. This is partly because member states themselves are often, quote, loath to expand those authorities and the budget needed for truly independent action. It's a resource issue, but also a political one. The organization has also faced criticism, both in the past with Ebola and during COVID-19, for being slow to declare public health emergencies of international concern, those PHEI case. They often seem to defer to affected member states, sometimes perhaps to maintain diplomatic solidarity.
It sounds like a really delicate and politically charged balancing act between global leadership and respecting national sovereignty. Is it fair to say that WHO tends to prioritize that solidarity, maybe over potential censure or calling countries out?
Based on the sources, that seems to be the pattern. The WHO has tended to prioritize solidarity and has been reluctant to criticize member states, even when there might have been questions about non-compliance with IHR or WHO guidance. During COVID-19, WHO refrained from calling out any nation by name for potential shortcomings. The deep insight here, I think, is that while the framework for global cooperation exists, its effectiveness is often hampered by the political will or lack thereof of its member states. They need to grant the WHO the teeth, the independence, and the resources it might need to truly enforce those regulations consistently.
So even with these limitations, are there established global frameworks that actually do work more effectively, maybe for specific diseases where there's more consensus?
Yes. There are some examples. The WHO Pandemic Influenza Preparedness Framework, the PIP framework, established in 2011, is often cited. Its goal is to improve the sharing of influenza viruses that have pandemic potential, and also to ensure more equitable access to vaccines and medicines during future flu pandemics. It brings together member states, industry, other stakeholders for a more collaborative and hopefully equitable global approach to that specific recurring threat. So understanding these global mechanisms helps us see that pandemic response isn't just about individual countries acting alone. It's about the strengths, yes, but also the weaknesses of international collaboration and the authorities, or, frankly, the lack thereof of these global bodies. It's a complex, often politically constrained web.
Okay, so with all these lessons from history and the recent past, what does this all mean for the future? Our sources offer several forward-looking strategies. They really emphasize a whole-of-nation and whole-of-society approach to preparedness. It seems to be about learning from past vulnerabilities to build a more resilient future, right?
Exactly. The profound lessons from COVID-19 and previous pandemics are actively driving significant efforts to improve preparedness. For instance, there was an AEI roadmap from March 2020 that suggested a phased approach for reopening societies safely. Phase I was about slow the spread triggered by community transmission, basically the immediate mitigation efforts we all experience,
Mhm.
lockdowns, masks, that sort of thing.
And what came after that initial urgent phase in their model?
Phase two was termed reopen, state by state. It allowed states to move forward, but only with clear data-driven criteria in place. Things like a sustained 14-day reduction in cases, hospitals being able to safely treat all patients without resorting to crisis standards of care. And, crucially, the capacity to test all symptomatic individuals and conduct active contact tracing. They estimated a national capacity of at least 750,000 tests per week would be needed for this phase. Then phase three, lifting physical distancing, would only occur once safe and effective tools like broad surveillance, robust therapeutics, or a vaccine became widely available. This roadmap really underscores the importance of clear, measurable metrics for moving through a crisis safely.
That's a very practical framework for navigating the stages of a crisis. Beyond reopening, what about the bigger picture? The overarching national strategies for health security that aim to address those systemic weaknesses we discussed earlier, testing, supply chains, coordination.
Right. The National Health Security Strategy for 2023-2026, for example, emphasizes several key pillars. First, strengthening health and public health systems themselves, improving resiliency, workforce capacity, risk communication, and health equity. It also explicitly addresses crucial impacts like climate change, cyber attacks, and especially emerging infectious diseases, noting that 3 out of 4 human EIDs originate from animals that vital One Health perspective.
Okay, so integrating human, animal, environmental health.
Exactly. Another key objective is building resilient supply chains. That means sustainable domestic manufacturing and vigilant monitoring of vulnerabilities, trying to avoid those shortages we saw. And critically, it aims to accelerate the development of medical countermeasures, diagnostics, vaccines, specifically mentioning mRNA, viral vector and protein subunit platforms, and therapeutics. The ambitious goal is development in months, not years. This directly targets the testing and treatment delays we saw with COVID-19.
And since a pandemic anywhere can quickly become a pandemic everywhere, there must be a strong focus on global strategies as well, right, in these new plans.
Absolutely. The Global Health Security Strategy from 2024 focuses heavily on international partnerships. It aims to expand support to at least 50 partner countries to help them build their own global health security capacity. Prevention is key. It advocates for that integrated One Health approach globally, integrating data from human, animal, plant, food, and environmental health surveillance systems for truly timely threat detection before things escalate. Legal preparedness and timely financing for responses are also highlighted, alongside diplomatic engagement to drive political momentum. And an important aspect is addressing equity, incorporating gender equity and social inclusion, recognizing how disproportionately marginalized populations like refugees, migrants, and women livestock keepers are often affected in these crises. This strategy speaks directly to the need for better global data sharing and more equitable resource distribution.
So, what about specific threats like the flu? We know that's a constant risk. We've certainly faced pandemic flu before.
Yes, and the HHS Pandemic Influenza Plan, which was updated in 2017, builds on those past lessons. It focuses on 7 key domains: surveillance, community mitigation, medical countermeasures, healthcare system preparedness, communications, scientific infrastructure, and domestic international response policy. This plan specifically aimed for a 12-week time frame for initial vaccine doses during a flu pandemic. That would be a significant acceleration from past experiences where vaccine availability often lagged far behind the peak of an outbreak. The overarching insight from all these strategies really is a comprehensive, interconnected approach, from local communities all the way up to global organizations. It demands investment in systems, in data, and international trust before the next crisis hits, rather than simply reacting to it when it's already at our doorstep. It's about being proactive and integrated.
We've covered a lot of ground in this deep dive, haven't we? From the devastating plagues of the Roman Empire all the way to the intricate details of modern global health security strategies. It's truly clear that while the pathogens might evolve, the human and systemic challenges often echo through time. We've seen the devastating consequences of delayed information, fragmented responses that eroded trust, but also the incredible potential of rapid scientific innovation and international cooperation when it works well.
Which brings us to an important question, I think, for all of us. Given these consistent historical patterns of disease, the complexities of global politics, the sheer speed of modern life and travel, can we truly achieve the kind of sustained, unified, and equitable pandemic preparedness these strategies call for? Or are we, in some fundamental ways, maybe destined to repeat some of the same struggles when we face future unknown threats?
It's a powerful thought to consider, isn't it? The work described in these sources, this urgent push for better surveillance, clearer communication, robust supply chains, truly integrated global partnerships, it isn't just about preparing for a specific virus. It feels like it's really about building a more resilient, informed, and connected world, one that's better equipped to face whatever challenge comes its way next. Thank you for diving deep with us today.